Welcome everybody to Remitbee Expert AMA. We are here for today's talk on COVID-19 and its effect on public health and society with epidemiologist Dr. Nevis, or Nevis?
Yeah, that's
Nevis?
good.
Nevis?
Yeah. You're good, Benita. Yeah.
Thank you so much for joining us. I mean, most people might say that they're sick about hearing about coronavirus, but I think there's a lot of misinformation going around, and something that should just be purely about health and safety has turned political. It's become really polarizing. This weekend, there was a huge, like an enormous protest at the square downtown, an anti-mask protest. So definitely some interesting ideas floating around. Some people might be a little louder than others, but that's why I think this is a great opportunity to have someone knowledgeable about the situation kind of share what's going on and how it's actually affecting everybody. So thank you. Thank you for coming on.
Thanks for having me, Benita. Hello, vanakkam, namaste to everyone. The three languages that I'm fluent with. Good afternoon. So I'm extremely happy and honored to be here and being part of this great social initiative by Remitbee. We are aware that Remitbee provides us with safe, secure, and fast way to transfer money across the globe. We can clearly see that Remitbee is just not focused on making profits, but also on giving back to the community. And of the many social initiatives that they have undertaken, this podcast, which invites guests from various fields to speak on topics, is important for the society. So when the senior management from Remitbee, Benita actually approached me to be a guest in one of the podcast, I gladly accepted the invite as I wanted to support their vision of community service. Okay, so let me introduce myself a little bit about myself first and also my interests. So during my medical practice in the suburbs of India, which was sponsored primarily by the United States Agency for International Development, or the USAID, I catered to the needs of women and children. And further, when I practiced medicine in other parts of the world, I was always asked questions on specific incidents and prevalence and trends of health and disease in a community, which actually sparked a great interest in me to pursue a career in epidemiology. So I just found the right opportunity after moving to Canada to start my higher studies in epidemiology. And at that time, not many knew what epidemiology was, nor who an epidemiologist is, right? So thanks to the pandemic, almost everyone knows now who an epidemiologist is. And in general, epidemiologists actually look at the distribution and determinants of disease and health in a population. They collect data, they analyze the data to study the trends in population. And using this type of analysis helps with evidence-based policy making, which we see in our day-to-day life in the news, or what the policy makers provide us with. So for our Tamil-speaking audience, there is a saying, "Kannal kanbadum poi, kadal ketpadum poi, thira visaripadai mei," which just means that you'll have to dig deep into evidence to find the truth. Okay, so that's kind of a short introduction about myself. Let's move on to the presentation. Okay.
So the PowerPoint's on the screen. Can you see it?
I can see it, but I don't think I have the... Okay. Well. Okay, so it's a little bit tricky. Okay, so now full disclosure, I work for Ontario Health as an epidemiologist and also at Brock University as an adjunct professor, where I teach epidemiology and public health courses. The views presented in my talk today are just my views and not of the organizations that I'm affiliated with. I also do not have any financial disclosures to declare. Okay. Now, having said that, in today's talk, we'll go over the epidemiology of COVID-19, the impact of COVID-19 on the society, and look at some preventive measures. So, what is a pandemic? So, we are all talking about a pandemic now, and we are aware that COVID-19 is a pandemic. What is it actually, according to the WHO, or the World Health Organization in Geneva? A pandemic is a worldwide spread of a new disease.
So, what's the difference between a pandemic or an endemic?
So, Benita, endemic and epidemic are other terminologies that is widely used in epidemiology and public health, which actually just relates to the distribution of a disease in a localized population. For example, malaria is endemic in parts of Africa. That's how we define it as. And SARS was an epidemic. It's not spread worldwide. So that's the difference. So COVID-19 was actually declared as a pandemic March 11th, 2020, after much deliberation by the WHO. If you all could remember, around, I think the last week of December 2019, some COVID cases were reported in Wuhan, China. And the number of cases started to rise rapidly, and it was deeply concerning at that time with the alarming levels of spread and severity. So WHO actually looking at the number of cases spread around the world, they declared it as declared COVID-19 as a pandemic. So I have a few friends who actually asked me, is there a specific number of cases that need to be positive to declare a disease as a pandemic? Well, no, there's no magic number. It really just depends on the distribution of the disease throughout the world. So after the declaration of a pandemic around mid-March, WHO actually launched the Solidarity Trial, which aimed at looking at the different research that could be conducted in the most effective ways to control COVID-19. So at that point, the different research that was undertaken was looking at treatments, looking at serology studies on antibodies, as well as some COVID-19 technology access pools, and also some studies on vaccines. So you would have all heard the COVID Alert app. So please do download it. It is helpful. It does not ask for your location. It does not track your location, as you can see in the small screenshot here, which I took on my phone when I tried to download the app. It does not ask for your name, address, location, phone, contact. So it's totally private. And what it does is, if you are positive, then probably you're going to just enter that you have been positive, and it actually captures someone who is positive through Bluetooth. And lets you know that if you are away, say, for example, in a shopping mall or in Costco, wherever you go, if somebody had your app and downloaded it and they have been positive, it would alert you that you have been exposed to a positive person. So it's actually a collective community undertaking rather than anything else. So please do.
Would you need to have your Bluetooth on all the time?
Yes. So,
Okay.
so that's why some people are not too confident because they think there are some privacy issues. They have to have their Bluetooth on and things like that. But still, it's worth a try. So these are some of the initiatives that are being taken by WHO through the solidarity trial that I mentioned, in order to control or reduce the harmful impact of COVID-19 on the society.
And what is a serology study?
Serology studies on antibodies are actually, they take the blood of somebody who have recovered from COVID and tested for antibodies, and then they try to develop vaccines from that, or even develop antibodies to COVID. So serology basically means blood, and that's what they're doing some studies on.
And in terms of treatments, like what kind of treatments have been tested or seem to be working?
Yeah, so if you remember a few months back, there were some antivirals that were being tested, which wasn't proved to be effective at all. But we haven't heard anything that's effective so far, because it's a virus and it's hard to treat. Bacteria are different from viruses. So COVID-19 is a virus, and they have been testing on certain antivirals. A few months back, even anti-malarial was tried out, but it didn't prove to be effective, unfortunately. So the studies are still, research is still underway.
Okay. So far, basically, it's just based on whether or not your immune system can sort of pull through on its own.
Yes, that's correct.
Okay, I see.
Okay, just to give, almost all of us know what are the symptoms of COVID. The primary, the big one is fever, right? And then dry cough and shortness of breath, and then you produce some phlegm or mucus. So others may have fatigue, which is just tiredness, muscle pain, or sore throat. So
I've also heard of people experience like stomach issues. Is that a common symptom, or is that more rare?
that's more rare, I would say, but just don't ignore any symptoms. If you're feeling unwell, get yourself tested. So I'm just talking about the symptoms that are like very common. So yes, you're right, Benita. GI symptoms are also GI means gastrointestinal symptoms. I'm sorry for my medical language, but and acronyms. But gastrointestinal symptoms such as diarrhea are also seen in a few cases of COVID. So here's an algorithm which actually tells you, you start off with fever. If you, yes, you do have fever and shortness of breath, you may have COVID. Please go get yourself tested. If no fever, if you have itchy eyes, you may have allergies or common cold or flu. This is just an example which I put out there. And there are many algorithms that can be followed. Go to the Health Canada website, Public Health Canada, Public Health Ontario website, where you can get more information on symptoms and how you follow a certain algorithm.
And so do you need to call ahead if you're going to go get a test, or what options are there for testing and stuff for people in Canada?
So for people in Canada, there are a few centers which actually ask for appointments, but there are a few walk-in centers as well which do COVID testing. So drive-through walk-ins, appointments. So it really depends on the region that you are living in, and I think it should be you will find out. There is a lot of information available on, if you are in Ontario, go to the Public Health Ontario website. There is information on how you can get the COVID test.
Cool.
So, usually, what we do when a disease is out there, we look at the natural history of a disease, which has like 4 stages. The first stage is the stage of susceptibility, where somebody or a person is susceptible to a specific disease. And in our case, it's the COVID that we are talking about. So, when they are susceptible, like you and me, Benita, can be susceptible to the virus. And if we get exposed, what happens is we have the virus in our body, and then there is a incubation period for every virus or a disease. So that's the period during which the virus replicates within our body and starts to show symptoms. That's the period when you get infected and then you start showing symptoms. So that's known as the stage of subclinical disease, or stage 2. And once somebody starts having symptoms, they are getting diagnosed either by the test or by your healthcare provider, and they show symptoms, right? So that's a stage of clinical disease. And then finally, the last stage of recovery, disability or death, depends on the individual person and their health. So we do say if you are diagnosed with COVID, please stay home, stay in bed, watch TV, do not use public transport. So that's something. It's something that you self-isolate yourself, take care of yourself and your health until you become all right, because during that stage you can be infectious. So you can be infectious right from the stage of subclinical disease up to the stage of recovery, when you actually turn COVID negative in your test.
So,
Okay.
so you can be contagious before you actually start showing symptoms.
Exactly. That's right.
Okay.
Yeah. So even if you're not having symptoms, you can be infectious. You can give it to somebody else. So that's what is here on this slide, actually. You can actually infect others even if you aren't showing symptoms. You haven't developed symptoms, which is actually pre-symptomatic, or even some people, they are positive, but they never get any symptoms. So that there have been certain scenarios where that has happened. So beware. Okay, so be very careful. You may be perfectly all right, but maybe spreading around the virus.
How accurate are the tests?
Well, the COVID, any test for that matter, any diagnostic test or screening test for that matter, can either be sensitive or specific, Yeah, that's right. So sensitivity is true positive, and specificity is true negative. So there is always a balance between sensitivity and specificity. So for a COVID-19 test, they are pretty sensitive. So I would say more than 80% accurate.
So, like in terms of, I guess, like travel restrictions, I understand now travelers have to go through the 14 days quarantine depending on where they're entering from, or in terms of Canada, you have to. Why can't travelers just take a test before and after their trip and sort of avoid the quarantine?
Well, that's a great question. So, as I mentioned in my previous slide, there is a stage where you can be asymptomatic but still be infectious, right? So if somebody is traveling and they do not have symptoms, they are COVID negative, still they could have contracted the virus anytime during their travel. So it's always advisable for them, once their travel ended, to isolate themselves for 14 days.
So the tests can only detect it if they are symptomatic, sorry?
No, not necessarily. The test can detect even when they are asymptomatic, but I said the test is accurate more than 80% of the time. There's always a little small chance, right,
Mhm.
for the test to be falsely negative. So why take that chance?
Okay. Yeah, that makes sense.
Okay, so here we will go over the COVID-19 cases by province in Canada. We are more focused on Ontario today. We are in Ontario. You could see that the numbers are, this morning I checked, it's way higher than this, but as of October 17th, these were the numbers on the Public Health Canada website. And you see a small, tiny graph here of Ontario, how the number of cases have been going up since April, July, and now in October. It's almost like we are up there. Um, Ontario has reported over a little over 700 cases this morning. So we need to be careful.
Are those active cases?
Yes, those are the cases which are positive.
This week, sorry, or this a couple days ago, right? The
To-
17th.
Total number of cases in Ontario as of October. So right from the beginning of January 15th or so.
Oh, okay, so that's not active cases then, right?
Total number of cases.
Total.
Yeah.
Okay. Do you have any idea what the active cases are after this recently?
So today morning, yesterday it was around a little less than 700, 650, around 650 cases that were test positive. And today morning it was around 700 positive cases.
Oh, okay.
So here is some graphs which shows the age and sex distribution of COVID-19 hospitalizations in Canada in total. So the dark blue is the number of males, and the light blue number of females who were infected with COVID-19 and were hospitalized. And that's the x-axis. On the y-axis, you see the age group. And clearly, the older age group are those who are hospitalized more, as you can see here. So people over the age of 60 are hospitalized more than younger people.
Mm-hmm.
So again, here for ICU admissions, again, we see that not many people over the age of 80 are admitted into the ICU, but people in the age group 50 to 79 have been admitted into the ICU. And you see the number of male who are admitted in the ICU is greater than the number of female who go into the ICU. Yeah.
Why aren't the people above 80 being admitted to the ICU? Aren't
Uh,
they? Wouldn't
uh,
they be even more at risk?
They may be, but maybe they didn't need ICU admissions, right? At some point, we don't know. We got to look at how sick they were. Did they pass away even before getting into the ICU, which is a probability, right?
Mm-hmm.
So
Yeah.
that kind of data has to be sliced and diced and looked into what was actually going on. But this is like a high level data which shows this is what is happening, and then to further dig into it is why that is happening is something that's going on.
Mm-hmm.
So my guess would be, it's just my pure guess without looking into any more details on the data, is that probably they were very sick, that they passed away even before going into the ICU. That
Mm-hmm.
would be my kind of guess. I, I,
Yeah.
can- I can be wrong, but that's what
Mm-hmm.
I'm thinking. If you This graph kind of explains your question, Benita, about the number of deaths. You see the number of deaths in the 80 plus group is way more. At least 70% of those infected with COVID die in the 80 plus age group. So which kind of explains maybe they are too sick that they die soon after hospitalizations and they didn't even had the chance to go into the ICU, right?
Mhm.
Probably that's what is going on. But you do see clearly that there is a trend that the older age group die because of COVID.
And there was more of spreads within retirement homes and things like
Yeah,
that, right? Yeah.
exactly. So, in those case scenarios, maybe they even died within the long-term homes and even before getting into the hospital or an ICU setting.
Hmm.
So let's take a deeper look at the epidemiology of COVID-19 cases in Ontario from January 15th to October 15th. On the x-axis, you see the months, and on the y-axis, you see the number of cases. So just following this through from March 11th, there was a high number of cases which peaked around mid-April, and then we tried to flatten the curve or try to get the disease under control. Now
Hmm.
again, starting mid-September, October, the number of cases are going up. So this is what is known as the second wave that people are talking about, right? So we do see that the different colors show that how COVID-19 spread. So most of it, you see the graph is filled with blue, which
Hmm.
is just through close contact and outbreak. So most of the people contracted the virus through close contact, friends, or outbreak.
So like
And
community spread mostly.
yes, yeah,
Okay.
exactly. So this kind of gives an idea as to why we should isolate, why we should take precautions of staying 2 meters away from other people, and why not to use public transportation when there is when you have tested COVID positive and things like that. So it talks more about the community spread. Yes, you're right. Um, So over here we see the curve in Ontario by age. The first wave, we saw that there was an increased number of cases among the older people, 80 or older. That's the yellow line.
Hmm.
And in the second wave, we are seeing that younger individuals, less than 40, are being affected. So 20 to 39 are being affected more than the older age group. You see the curve is almost close to zero among the older age group. But people in the age of 20 to 60, 59 is what is trending up high recently. Uh,
And is that
yeah.
just due to things being, well, for a while at least, things were opened up again and people
Hmm.
were doing more things, getting out of
Yeah.
their house? Yeah.
Yeah, so getting out of the house, you see this age group and this age group, they are mostly in universities, in schools, and the working class of people. So that's where we are seeing the trend go up. Yeah, yeah, you're right. Bars, restaurants were open, people were having fun, I guess. So
Yeah.
you can relate to it.
I miss it.
Yeah. Okay, so we are the number of deaths have gone down significantly. You see, mid-April, there was a large number of people who died, but knock on wood, not many deaths during the second wave. Probably, I think it's because COVID is affecting the healthier age group, as we saw in the previous slide, age group between 20 and 59. They are pretty healthy, not much comorbidities, so probably that's what is going on, and the number of deaths have gone down. So here we also see the confirmed cases of COVID-19 by severity in Ontario, and you see again deaths were reported more, at least 30%, in people who were aged 80 and over, whereas we see that deaths in the younger age group is almost negligible. So now that schools have opened up in some parts of Ontario, and you see that the number of cases among the school age children is going up. So mostly teenagers, 9 to 13 and 14 to 17 age group is kind of having an upward curve.
Is it as dangerous as a disease for younger kids and teens as it is for older, or because their immune systems are still growing and getting stronger as well, right? Or is it still a little bit safer for children to have it instead of the elderly?
Well, Benita, to have a disease is not safe at all, regardless of how your immunity status is. You're young, you're old, having a disease is debilitating. You can be sick, and it's more on when kids are sick, it's more about the parents to take care of them, and it just causes more stress in the society. I would like to look at it that way rather than thinking whether it's safe or not safe. Having a disease can never be safe. Having virus can never be safe, right? So,
Yeah.
They they may not have severe outcomes like death, like somebody in an older age group would potentially end up, but still, it's hard. It's hard for the kids themselves as well, the parents.
Oh, yeah, because I guess parents would have to also quarantine for those 2 weeks,
Yeah.
as well as taking care of their children. I mean, this is more of a health issue at this point. It's affecting like the economy, obviously, and it's also spotlight to issues within our society.
Exactly. So it has a wider impact, especially when children are affected, right? So it's just not them, the adults who are involved in taking care of them, um, their friends, their teachers, their class, whatever, right? So we need to be more vigilant when kids get sick. This is an interesting curve, which I thought I would share. We saw that during the first wave, women were affected more than men. Whereas at the second wave, it looks like almost the two lines are overlapping here. I'm really not sure why this was going on in the first wave, but this is what data is showing. But thinking about it a little bit more, just not looking at data, I think that women were socializing more, or maybe even at the gym you would see that women like to take group lessons, whereas men work out by themselves, right? So I don't know. So maybe that's what was going on, but then it quickly kind of dropped. So women, the number of cases among women quickly dropped, and then the lines are almost overlapping.
Women just being too social.
Probably. Yeah, so here is another interesting concept in epidemiology, the reproduction number, or the RE, or the R naught. So what this is the number of people one infected person can actually pass the disease on to. So we would like to have the reproduction number close to 1. Okay, so if you notice around mid-March, it was close to 3. And quickly, due to the different preventive measures and that was taken by the community, the numbers started dropping and came almost close to 1 and less than 1 for almost end of April, which is a good thing. And now we are also getting close to 1 mid-October. So
So sorry. So that basically is like one person infects one person in that case.
yeah, so
Okay. Okay.
this next slide actually describes what or not is. So this person is infected, and this is a hypothetical scenario where one person is infected. They pass it on to 2 people. So here the reproduction number is 2 or the R naught is 2. So this person, when they get infected, they pass it on to 2, so on and so forth.
Mhm.
So we don't want this to happen. Even with the reproduction number of 2, look how many people end up having,
Yeah, it's
right? So
exponential. That's
mhm.
crazy.
Exactly, exactly. So this interesting concept was identified by George MacDonald in 1950s when he was an epidemiologist. Obviously, I know all these epidemiologists' names. I'm crazy about epidemiology. So
Mhm.
anyway, so he actually came up with this concept when he was looking at malaria and how it's being transmitted among people. So and also, if you have watched the movie Contagion, you would have noticed that they were talking about R naught in that, and that's just not a Hollywood concept. It's a real epidemiological concept. So yeah.
How realistic is that movie? Should we be worried?
Well, no, it's a movie, right? So I'm just talking about R naught, Benita. Okay, so I thought I would also share some data on race and ethnicity. Ontario is widely multi-ethnic, so we I tried to find some data but couldn't find much. So I had to get this data from the Center for Disease Control in Atlanta. It's mostly data from the US, where we see most of the people infected with COVID are white, and this followed by the Hispanic, and then the Black, and then the Asian or not Hispanics, comprise of almost 3%. Right? That's not bad compared to 43% among the white people. And there's also deaths by race and ethnicity. And we again see that the number of deaths is higher among the white and non Hispanic people compared to the other races.
And is that just more because maybe like non-racialized communities are being exposed to it, or is there something like within people's genetics that would make them more likely or less likely to be more affected by it? Is there any information on that?
Well, I really don't know about the genetics or the immunity buildup of people, but in general, this is what data is showing. And thinking about it, probably people are not following protocols, or uh, I don't know. I don't know really. It has to be looked into with in a different perspective for sure.
I know there are more cases sort of in the racialized communities within Ontario, and like that has kind of caused I don't know what the correct word is, but like it's caused some issues and some racism, I think, unfortunately. Um,
Yeah,
yeah.
we definitely need to look into that data more on COVID-19 cases among the racialized community, as well as people living in certain areas within Toronto or even in Ontario, right? So,
It's interesting that the data for races wasn't like for Ontario and Canada wasn't readily available. Like you had to like look into the data from the CDC from Atlanta, but
For
Yeah.
I did see some data uh, on COVID-19 cases in different regions within Ontario, but
Mhm.
I wasn't sure whether that would be very helpful for our audience. In terms of race and ethnicity, that would give an overall idea of which race is being affected more, I thought, rather than
Mhm.
going into the granularity of the regions within Ontario. So this would
Mhm.
be more appealing to a wider audience. So.
Mhm. No, no, that makes sense. Yeah.
So we did look at some of the severe outcomes of COVID-19 before, Benita. We talked about hospitalizations, ICU, intubation, or mechanical ventilation, and eventually death. So um, the most in most cases, people recover. Um, they do fine. But if you do have some sort of morbidity, like one of these listed here, cancer, like chronic kidney disease or lung disease, or somebody has a transplant of an organ and they are put on immunotherapies, so such people's immunity is suppressed so that they don't reject the organ, right? So what
Mhm.
happens, the immunity levels go down and they're not able to fight the virus. So these kind of people are at increased risk for severe illness, which means that they might need hospitalizations, they might need intubation, ICU care, whatnot. Even other conditions such as serious heart problems or sickle cell disease, which is just an inherited blood disorder, or type 2 diabetes. Even people who are obese can be at an increased risk for developing complications from COVID-19. So these are the list of people who are definitely at increased risk for severe disease, and they should be vigilant. And this is a list of conditions where people might be at increased risk, and always having a comorbid medical problem is an issue, right? So I think almost 40 to 50, 40 to 41% of people have some sort of condition that put them at increased risk.
So related to that, we have a question from one of our audience members.
Mm-hmm.
Benuja S says, I've heard that hospitals have changed rules as a result of COVID when it comes to labor for pregnant women. Can you speak to safety measures around the delivery experience? And also, I'm going to add in, is COVID more dangerous for pregnant women?
Well, pregnancy in general puts you at an increased risk for diseases and in general, right? So you are your physiological status changes, and you are at an increased risk at most of the time. But there are certain protocols that come into place, especially in delivery units or um, in labor units where actually babies are born. So I'm sure that hospitals are following protocols, and if patients are following protocols, it should be a good experience for everyone.
And then we have another question from Nusha Pereira. What's the best way to self-isolate with a positive family member, and can they use the same washroom as a positive person?
Well, it is always advisable not to use the same washroom. The best way is to stay at least 2 meters away from your other family member, or even while talking, or even while providing food, and to have your own washroom and bedroom where you can stay for 14 days. Isolation means you should not have any sort of contact with other family members. So having a separate washroom is a must. You need to stay away from your family member at least at a distance of 2 meters. So I had a friend who, or a colleague or who, whatever, I know somebody who tested positive, and what they did was they self-isolated themselves in their own home where they had their own washroom, everything, their bedroom, a TV, where they stayed for 14 days until they turned, I think they turned negative around day 10 after testing positive. The symptoms were mild. It was mild to moderate, but they did their best. They were served food by the family members. They left the food outside the door, and they had evening chats with the person who tested positive, at least 2 meters, sitting in the hallway talking to them. So it was isolation, but still they took the precautionary measures, and none of the other family members were infected, and they also turned negative and doing well. So isolation, definitely, separate washroom is a must.
Another question from Anusha. If I am positive and have no symptoms, can I cook food for other family members?
I don't think so. If you are positive, please isolate yourself. You can be positive and asymptomatic, but still be spreading the infection to other family members. And cooking food is something that I wouldn't recommend that you do. Please isolate yourself.
And another question, would you recommend cloth masks over disposable masks?
Well, it really depends. There's just wearing a mask should protect you. It should be good enough. Disposable people, I've seen people use disposable masks over and over again. And disposable masks are there for a reason. You dispose it off, right? So that's why they are called disposable masks. It's a one-time use it and dispose it off. Cloth mask also can be used effectively as disposable mask. The only issue is keep it clean. You use it once, come home, use a nice soap and water to clean it up and dry it and reuse it. And also make sure it's inside, you put it inside a nice plastic bag, and it doesn't, because it just goes on your face. There could be germs floating around, and you don't want to get sick from other diseases, just not COVID. So any mask, any type of mask is okay, but disposable mask is a one-time use mask. Please throw it away.
Okay.
Okay, so let's talk about some preventive measures. Herd immunity. Herd immunity is a concept that is a public health concept, actually, where you see on this right side of the picture, you see this one infected person is infecting the other person, but then not too many, like how you see on the left side of the figure, because all the people in green are immune either by vaccine or some other sort of immunity that they have. So that's what is herd immunity is about, the concept of herd immunity. So in herd immunity, what happens is usually achieved when vaccinations are given. So, for example, the flu vaccine, if at least 70% of the community people take the vaccine, the rest 30% are protected. So that's what herd immunity means. So WHO said without the vaccine, there is no chance of herd immunity for COVID-19. So we need to follow all the preventive measures put forth by the public health, like wearing masks, staying away 2 meters, and things like that. Okay. So So I think we discussed this a little bit when we started the conversation about antiviral drugs and about monoclonal antibodies, the research that's going on, and on convalescent plasma as well as vaccines.
Mhm.
There's still research, there's nothing definitive yet. We really hope that something good comes out of the research that is being conducted throughout the world. So it's all evidence based. And talking about vaccines, vaccines are approved by Health Canada and in the US by the FDA before it could be widely distributed. So to get to that stage is not easy. Okay, so as soon as anyone, when I tell anyone that I'm an epidemiologist, the first question is when are we getting these vaccines, right? So
Mhm.
it's not that easy because we knew very little about this disease until like last year when it started, right? So end
Mhm.
of last year almost. So it's been only like a 10-month period during which we are learning more about this virus and trying to develop a vaccine which should actually have no safety concerns. It should have adequate immune response, as well as the benefit should outweigh the risk. There may be a few adverse effects like itching or whatnot, allergies, but the benefits should definitely outweigh the risk. So in order to get a vaccine, a typical timeline for vaccine production is first we start off with research, then do some preclinical research. Then there are 3 phases of trials, and then they start manufacturing the vaccine. Approval is given by Health Canada in Canada, and then it is distributed. So when we follow an actual timeline for vaccine production, even if we started off right in the beginning of 2020, it might be by the third quarter of 2021 is when vaccines will be distributed widely. But however, we are trying to, there are several steps that could be skipped. So skip research, for example, combine phases, building factories, producing quickly. So maybe the timeline could be reduced a bit, but not too much.
And is there any sort of way that they will be distributed to people first, like maybe doctors or maybe more at risk elderly, or will it just be pretty even in terms of who gets it once it's ready to go, once it's safe?
That's a very political question, Benita. And,
Sorry.
I'm not sure. I'm not sure. I really hope, as an epidemiologist, that it's been, if when approved, it's available for everyone. Everyone is equal. I'm
Mhm.
all for equality, and I really hope it's available for everyone at the same time.
Mhm.
Of course, as you said, maybe healthcare providers are at increased risk. Maybe um, uh, uh, older people are at increased risk. Maybe they could be given vaccines earlier on a basis that they need it more than others. But
Mhm.
I really wish that everybody could get the vaccine at the same time.
So we have two more questions.
Yeah.
One is by the beauty duo, and they said, makeup artists are now going back to work around the world. How can they effectively disinfect their makeup brushes and makeup products so as to not spread the unwanted?
Oh, that's a great question. I'm always, uh, I don't know the word that I would use. I'm nervous about going to beauty salons where they do not disinfect the brushes or even the combs or after a single use. They have to follow strict guidelines, public health guidelines. If you find that they are not following it, you can always bring it to the attention of the public health authorities. So yes, that's really important.
But it is so there's guidelines
Yes.
made by the and you could probably check that out at like
Yes.
Health Canada Health or some website like that.
public health guidelines on Public Health Ontario. If you're from Ontario, or Public Health Canada website has all information on the different guidelines for beauty salons to follow. If you find anyone not following, please do report to the public health authorities.
And another question is, would you recommend flight traveling with a baby during this time?
With a baby, if your travel is essential, then yes, go ahead. But if it's non-essential, just for fun or for vacation, please do avoid traveling at this time. It really depends. You'll have to make a judgment call there. Do I need to go? Is this urgent? With the baby, then probably you have to make that judgment call. So let's go ahead with flu vaccine. I do have a few of them ask me this question on flu vaccine because there's the flu season. Should I get the flu shot? Will it put me at increased risk of getting COVID? No, it will not put you at increased risk of getting COVID, nor will it protect you against COVID-19, right? So get your flu shot. So it protects you against 2 types of influenza, 4 types of influenza, 2 types of influenza A and 2 types of influenza B. It's a quadrivalent vaccine. Get it so that you don't get the flu and the COVID, right? Mm-hmm. So get the flu shots. I'm a big believer of vaccines and prevention. So please do get it when there is time. So here is some guidelines on traveling during COVID. Every airline has its own protocol as to the cleaning procedures and mask wearing and things like that, and also enforcing 14 days quarantine once you have arrived at a certain destination. So please do follow those guidelines during traveling. And hand washing, of course, wash your hands. I can't stress enough. Use soap and warm water for at least 20 seconds. Rub your hands and use a hand sanitizer if available, which has at least 60% of alcohol.
No vodka?
Sorry?
I said no vodka.
Oh, no. Okay, so... okay, so we hear, yeah, Benita, go ahead.
There's another asking about the long-term effects of the virus to your immune system after contracting it.
So what is the question? Do we have any long-term effects?
Yeah.
That's a very interesting question. So I did read a paper recently on immunity, long-lasting immunity. So this COVID-19 is actually belongs to the coronavirus umbrella. Okay, so what I mean by that, the SARS in 2003, if you remember, also belongs to the coronavirus. So coronavirus and then the SARS and now it's COVID-19. So they're all under the same umbrella. So what happened, the paper that I read recently, which was published in, I think it was Lancet, a medical journal, they said that people who contracted SARS during 2003 are immune to COVID-19. So almost 17 years back, they had this virus, right? So they have been having this long-term immunity over the years, and the chances of these people who had SARS and developed immunity of having corona or the COVID-19 is very low. So there is still research going on as to look at whether the person who's infected with COVID-19 has a long-term immunity as well. So that's still something that's interesting, and studies are going on, but recently, this was the paper that was published, which says that people who had SARS cannot get COVID-19. I don't know whether that's true. There's always limitations in research. We need to do more, dig into more of that type of data. Okay, so here's an interesting story on hand washing. Have you heard of this Dr. Semmelweis, Benita? No? Yes?
Did
No?
he
Yeah.
get in trouble for something he said within the medical community?
That's right. So he look at him. He's just 47 when he died, and that's the picture when before he died or something. He
He
just
looked
looks
older than
too.
47.
Yeah, exactly. And he's a physician from Hungary, and what he did was he's the pioneer of hand washing. This is a picture of the obstetrics clinic in Vienna General Hospital during the 19th century, during his time when he was living. And you do see a picture here on the left that doctors washing their hands, and a mother here with a baby, and a typical scenario in during that time. He actually found that the number of people or mothers dying in the first clinic, which was actually staffed by physicians and medical students, was higher compared to the number of deaths in the second clinic, which was staffed by midwives. We would guess otherwise, right? We would think that physicians and medical students are more equipped or more talented or more educated to prevent maternal death among women, right? So but it was the other way around, and he started investigating, looking at what's going on. So what really was going on was the midwives in the second clinic took care of women straight when they came back, when they came from home. That was their only duty and responsibility. Whereas in the first clinic, the physicians and medical students went to the mortuary, conducted some postmortem and on dead bodies, and then came to deliver babies. So
And they didn't
during
wash
that,
their hands?
yeah, exactly. They did not wash their hands, and they were transmitting all the bacteria or viruses from the dead bodies to the live mothers, and mothers got sick and died. So the number of cases among the first clinic was higher compared to the second, right? So he was called crazy, and I think he was even beaten up by the guards in the mental asylum, and he died poorly, poor guy. But you know what? And after he died, I think around 1890s is when bacteria and viruses were actually discovered, and that's when Louis Pasteur came up with this germ theory of bacteria, viruses, and blah 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 and whatnot, right? So, and then they realized that what this guy said was actually true. We need to do proper hand washing techniques. So, wash your hands well, rub it, and at least spend 20 seconds washing your hand with warm water and soap. So in that, this is just to show bacteria, Streptococcus pyogenes, which can be seen on the slide here, and how you see it being on a Petri dish after a no wash in A. You see the number of bacteria there. And after a regular wash with soap, you still have some left. And then after an alcohol wash is when it completely dies. So this is just to give an idea as to how important hand washing is, using hand sanitizers and so on and so forth. So another preventive measure is mask. You are preventing other people from getting sick. That's what masks are for. Please do use it in public transportation, in stores, wherever, in personal service settings, such as somebody's question here on the beauty salon. They definitely need to wear a mask when they are providing services to you.
Another question before we wrap things up. can COVID spread through water, for example, swimming in lakes or beaches, swimming pools, etc.?
As of now, I think COVID is mostly spread through respiratory droplets. Okay, so which means cough, saliva, things like that. Through water on the beach, it's highly unlikely.
Okay.
So again, let's just quickly wrap it up with here is a list of hard surface disinfectants, which you can find if you're looking for something like a Lysol, whether it's effective or not. Here's the link in Health Canada website. You go look it up to find the list of hard surface disinfectants. And to end on a positive note here, you will see that most people who get COVID-19 recover from it. And this is not something that I am making up. It is from the World Health Organization. So let's end all of this in a very positive note. And thank you for having me. And I thank Remitbee for having me here. They should continue this great work of community service. And thank you, Benita.
Thank you so much for joining us. I know you have a meeting you need to rush off to. So, and I hope the audience found this session as well. Thanks. Bye, take care.
Bye-bye.